or English?
In English.
Okay. Okay. Is everybody okay?
Yeah.
You can start that. Okay, you can start that.
My name is Hatawa Adil. I am from Iraq and I finished my baccalaureate at the University of Suleymania in Iraq. I would like to thank all of you to be here today. It is an honor and proud for me to see all of you today. A lot of thanks to my supervisor, Dr. Abudar, my co-advisor, Dr. Murad, and to the committee members, Dr. Janan and Dr. Muhammad, and for all of you. Thanks again. My thesis study is about peroxynitrates and trace elements in patients with aortic valve sclerosis. So the contents of my seminars include, in general, information about the heart patient method, result, discussion, and conclusion. Firstly, I would like to explain a previous information or introduction about the heart. So the heart is a biological pump, consists of arterial and ventricle, and also consists of 4 valves. The heart also consists of 4 chambers, which they are right atrium, left atrium, and left ventricle. And these are 2 chambers, which is right atrium and left atrium, are responsible to connect the incoming blood to the heart. Heart valve are a soft tissue structure responsible for unidirectional blood in the heart. So we have 4 valves in the heart, which they are pulmonary valve, the shape of pulmonary valve in conjunction with the right atrium, and tricuspide. This is the shapes of tricuspide. It is normal shapes. It is in conjunction with the right atrium, right ventricle, and the aortic valve, which is in conjunction with the left ventricle, as well as the mitral valve, which is in conjunction with the left ventricle. So the task of all of these valves actually is unidirectional blood flow in the heart. This photo illustrates how the valve should be worked in general way. So this part shows us the valve should be open fully in order the blood can flow through. And in the other part, the valve should be closed tightly in order to prevent the flow to the backward in the valve. So this is general shapes of the valve when it should be open and closed in fully and tightly. And this is the general direction of the blood through inside the heart. It should be like this direction, and in this case it will be healthy heart valves. Now the aortic valve. Aortic valve, as it is described in this photo, it is a tri-leaf simulator valve, which is consists of right, left, and non-coronary aspects. And this valve also sometimes it is named as simulator valve, and this is due to the, as it is described from the photo, it is consists of 3 equal sized leaflets, and it is shaped like half moon, and that's why it is named simulator valve. Also, this valve is a flexible membrane which can open and close more than 100,000 times a day with each heartbeat. So fortunately, all of us till now we have a healthy valve like this valve. So we don't know in the future what will happen. Now our specific topic, which is about aortic valve sclerosis. It is a type of aortic disease, aortic valve disease, and it is defined as technique and classification of the aortic valve in the absence of obstruction or ventricle out of loop with a gradient more than 20 to 25 millimeter mercury. This is a shape of aortic sclerosis. As you can see, this is not normal aortic sclerosis, not normal aortic valve. It is calcified and techniques presence in the left of the valve. So this disease was discovered and description first time by Monokeberg 94, and it is most common disease in the developed nation and present in Western country, especially in the US and Europe. So the epidemiology of aortic suggests that it is occurred in about 30% of the people who are aged between 65 to 74 years old, and this ratio will increase to 50% in the persons who are older than 84. So this disease is more common in the elderly people, not in the younger. This photo shows us the differences between the normal and the restricted valve, the normal valve and the abnormal valve. This is the heart, which is lying on the upside of the right human body, which consists of aorta. It should compose of 3 leaflets in normal way. When the valve is normal, like in this shape, it should be healthy. When it is open, as I mentioned before, it should be open fully, and when it is closed, it should be closed tightly. In contrast, in this part, we can see that the valve is restricted. And this is due to the decomposition of the nodules of calcium. And with the time, this disease may be progressed to more severe phase, which is labeled aortic stenosis. And this is depends on the deposition of the lipid cells, and which lead to the decomposition finally to the nodules of the calcium. Diagnosis of aortic, generally we have two types of diagnosis. Firstly, by using of echocardiography, like this photo, and it is by qualitative technique of the aortic valve. Whereas also the second type is by using demonstrated calcification of the aortic valve by using computed tomography CT scan device. So this is ancients of echocardiography. This is photo of CT scan computed the tissue of the aortic sclerosis. Therefore, we can say that there are 5 stages of the aortic, which is started from the stage 0. That means it is no replication of the aortic valve like this, yani the normal replication. Step 1, that means slightly accentuated replication, and the technique is more than 2 millimeters. The stage 2 is a slightly accentuated replication, and the technique is between 2 to 4 millimeters. Stage 3 is generalized over-replication, and the technique is more than 4 millimeters. Whereas the stage 4 is clearly overshadowing masses, and the technique is more than 6 millimeters, and this is very dangerous stage, and in this case maybe the patient needed to replace his valve. Symptoms of aortic sclerosis. In general, this disease is asymptomatic condition and commonly referred to as systolic noise during physical examination. So the presence of systolic aortic determined is often the first clue which alerted the physician to the possibility of aortic valve. This is general photos of the physical examination which applied on the heart patient person. But in sometimes this murmur cannot be present in the aortic patient. So the must and the golden diagnosis to identify aortic sclerosis in this case is by using echocardiography. So this is the photos which was taken by the echocardiography. In this part, as we can see, it is normal. The left list is normal of the aortic valve, no calcified, no technique of the aortic. In contrast, in the second part, it is clearly visible that on the left list there is a calcified, there is a technique on the surface of the left. So this is the differences between the normal and disease aortic by using echocardiography photo. Treatment of aortic sclerosis. This disease is, unfortunately, there is no currently proven effective medical treatment for the disease. So there is no randomized controlled trial on drug therapy in aortic sclerosis. So we can say no medical intervention can or able to delay or stop the aortic progression. So in this case, the patient, the only solution for this problem is that to change the aortic valve, and we have actually 2 types of valve replacement. Maybe there are 2 common types, not 2 types. The first of all is biological valve, which is maybe from xenograft. It is taken from the animal's tissue, for example, pig or cow, or maybe autograft from the another person tissue, or it will be homograph from the patient's tissue himself. But this valve actually it has a side effect. For example, the patient maybe causes a clot of the blood of the patient, so the patient should take anti-therapy coagulant for all of his life. The second type also is mechanical valve, which is made from synthetic plastic. This is a general artificial valve. For example, here we have gadget ball, and these are stainless propane valve. This is an example of the artificial valve. The previous slide, generally, I mentioned and explained all information about the disease. So is there any question about the disease? Anyone can ask? Now I'm going to talking about the parameters where we use it in our study. First one is peroxynitrate. It is a reactive nitrogen species which generated from the reaction of superoxide and nitric oxide. Actually, peroxynitrate is a cytosolic molecule. It is known as a strong biological oxidant and nitrating agent. It is capable to interact with a vast molecule and biomolecule in the body. But the aortic valve can tag and target some possible tissue in the body. For example, it can damage DNA, damage protein, damage lipids. So it is lead to injury of the cell and finally death of the cell. But on the other hand, we can say that peroxynitrate play an important role in the inflammatory response and modulating vascular, whereas in the physiological study, we can say that the beneficial action of peroxy may be due to the reaction of it with the red cells, glutathione, plasma or plasma albumin and cysteine with the production of nitric oxide or nitric oxide-like compound. The other part of the parameters is about trace element. So trace elements are essential nutritional components of enzymatic human system. So they are those compounds which they are need to be available in the human diet to preserve normal physiological bulk. So the deficiency of trace elements and minerals today is widespread and common among the population and leads to nutritional problems. So they are also in noticeable relation with the cardiovascular disease endpoints. Their excess in the body may lead to obesity and finally resulting toxicity. Among all of the trace elements, we choose four elements in our study, which they are selenium, zinc, iron, and copper, and they are integral part of enzymatic antioxidant. Also, they are catalytic regularly and structural ion for enzymes, transcription factor, and protein. Thus, these elements are critical elements for very different hemostatic mechanisms of the body. Also, they are related together against reactive oxygen species and nitrogen species in the defense cytosolic of the body. So the main part is our aims. Our aims actually were to investigate the association among the aortic patients, disease and serums of nitrosative stress of peroxynitrate and the essential trace elements like copper, zinc, iron and selenium in the serum of 80 subjects of the Turkish population in the Gaziantep. The second aim were to explore the clinical significance of serum human peroxynitrate, selenium, zinc, iron as a potential new biomarker in these patients for aortic patients and to clarify pathophysiological role in individual at risk for developing aortic stenosis. Now the patients and method part. Generally, our study included 80 subjects were divided by two groups. The first group were patients group and their range, their number 40 patients and they composed of 30 female and 10 males. Similarly, for the healthy controls, we also have had 40 voluntaries with the same gender and ratio for the patients group. Now we started the collection of blood samples. The first step of this process where the subject in the sitting position, the incubator area of the forearm, as described in this photo, stabilized by wiping with alcoholic cotton. The second step, by using of needle, BD vacunated needle, we take 5 ml from the patient and then gathered and transferred to the vacuum tube to be ready to allowed in the room temperature for approximately 10 to 15 minutes to be coagulated. After coagulating, the other step is that we put the samples into the centrifuge device for 10 minutes at 400 RPM to get the samples. And when we get the samples, the serum, we put it in the Eppendorf tubes and then we read all of the information which related to the disease, and after that we save it at the freezer for -90°C until analysis day. So the assessment of the parameters is started with peroxynitrate. So this levels of peroxynitrate was assessment by the spectrophotometric method procedure as described by Van Offlin 1989. The first step of this procedure actually by taking the samples and added to the sodium phosphate buffer solution, and after that we cover the tubes in very good way to prevent any interaction with the weather. And after that we put it in the incubator for 2 hours at 37 Celsius. It should be in dark place, and this is also to prevent any interaction with the lights of the room. We get out the samples from this device and we add sodium hydroxide to be read the absorbance of the samples at the wavelength 412 nanometers and the concentration directly registered on the spectrophotometric device. And after that we got the concentration of peroxynitrate. The second estimation is where for iron, when the photometric color test for the quantitative determination of iron in human serum was applied on the AU-Beckman culture analysis. First step of this assessment, we put the sample in these special tubes, and we covered the samples to be ready to put in the device. And after that, we put the device like this shape in the Beckman culture AU 580 to measure the concentrations of the iron. And the normal ranges of serum in the adults was between 100 to 25 microgram per deciliter. The third assessment actually were for zinc and copper, where this analysis is performed by the flame atomic absorption spectroscopy, as is mentioned here. It is AA680 device, and the concentrations of zinc were between 65 to 140 microgram per deciliter, whereas for the copper were between 20 to 70 microgram per deciliter. So this is the device when we assess the copper and zinc, and we get the concentration of them. The final assessment were for selenium, when the samples is diluted by the acetic acid, and then by using of injectively coupled plasma spectroscopy, which is ICM mass spectroscopy device, we got the concentrations of the selenium. And the normal range of selenium is between 60 to 71 microgram per liter. Now I'm going to explain our result. As I mentioned previously, we had two groups, which patients and control. 75% of the patient group were from male, whereas 25% of the patient group from the male, sorry. So likewise for the control group, also 75% were from female and 25% from those control were from male group. And the age for the patients ranged between 39 to 65, whereas for the control ranged between 42 to 65. The clinical characteristic of each of gender, diabetes, alcohol, and smoking are shown in this table. For example, for gender, alcohol, and smoking, as here it is written in white, the p-value, there is no significant differences between both of the group for each of the gender, alcohol, and smoking. Whereas for the diabetes group, as it is mentioned in yellow color, there were a significant relation between the patient as compared to the normal group. Among our subjects, we had 70 persons who had a diabetes. We had just 10% who drinking alcohol, whereas 5 persons of all the subjects, they are smoking cigarette. This table illustrates the older and the newly patients, so it is according to the history disease of the patient. This is just related to the patient's group. And as we can see, 50 patients, they are come to the hospital for first time, so they are newly patients, whereas 80% of the patients, they come to the hospital previously, so they don't come first time, and they have this disease approximately 2 to 10 years before they come into the hospital. This is the main table. As we can see, for the age, iron, copper, selenium, there is no significant differences between the patients and the control group, whereas for the body mass index, hypertension, diabetes, peroxynitrate, and zinc, as mentioned in yellow color, there were a significant correlation between the patients and the normal donor. I'm going to explain each one previously to be understandable. For example, the box blood of serum peroxynitrate, it is higher, significantly higher also in the patient group in compared to the control group. So we can see also the minimum levels of the serum peroxynitrate were higher in the maximum level of the control. So it is really significantly higher in the patient as compared to the normal group. The second one is for iron. The box blood of iron also illustrates decreased of iron level within the patient's group as compared to the normal valve. So here it is also decreased, but not significantly. For selenium, box blood shows that selenium were lower in the patients as compared to the healthy valve. For the copper, the box blood of copper shows that it is higher in the patients in compared to the normal donor, but also it is not significant. In contrast, the box blood of serum shows that it is significantly lower in the patient group when compared to the healthy group. So it is significant lower in the patient's group, as it is mentioned here. This table also, it is correlation among the parameters in the patient's group. It is described here that the systolic blood pressure had correlation or significant positive correlation with each of the diabetes, body mass index, and with the age. And here for iron, it has a negative significant correlation with the copper and positive significant correlation with the selenium. In contrast, for zinc and diabetes, as here it is clear, there is no any significant correlation between these parameters among the patient's group. The final part, it is discussion and conclusion. As we say that the aortic valve sclerosis is a type of aortic valve disorders, and it is defined as calcified and thickening of the aortic valve in the absence of the obstruction out of loop of the ventricle. So the present study is the first study which attempts and evaluate each of the peroxynitrate and zinc, selenium, copper, iron in the patients with aortic valve compared with the healthy valve. We can say that the main finding of our study is indicated for first time that peroxynitrate concentration were higher in the patients of aortic sclerosis in comparison with the control group. So similar results were also repeated by GDOG 2015, in which statistically significant effects of peroxynitrate were detected in patients with acute coronary syndrome in French population than those of non-aortic acute coronary syndrome. I just want to mention an important thing. Since our study were first study to evaluate peroxynitrate, zinc, selenium, and iron, so it was difficult for us to compare our data with the previous study. So in this case, we may compare it with the general heart or general disease with the heart. So for example, here the acute coronary syndrome, it is a term used to describe it, a condition, a range of condition with the sudden blood flow to the heart. So it is generally heart disease, not related to our disease. With regard to the gender, alcohol, and smoking, there were no significant differences between the groups, where the p-value is greater than 0.05. In addition, this study indicated that there were significant differences between blood pressure and diabetes of the valve patient in comparison with the normal valve, where the p-value is less than 0.05. Also, among the Turkish population, we found imbalance in several of the trace elements. For example, we detect high accumulation of copper in aortic valve sclerosis patients when compared to the normal serum ranges. So, copper value in aortic valve was found to be higher in the present study than those of copper levels in each of the study. COSAR 2005, COSAR 2006 in Turkish population in the disease of rheumatic heart disease and in heart failure patient disease. But it was lower